Bob, thank you very much for making the time for the conversation today.
Yeah.
I really appreciate it. And I'm glad I get a chance to actually sit and talk with you for some time because there's a lot I want to know about Integrity House, and there's a lot to know about Integrity House. So, for the first question I'll ask, for someone who doesn't know Integrity House historically or even present day, what is going on here? What is this organization?
All right. So that's a great question, and let me take you back to the beginning.
Please.
So Integrity House was founded in 1968. It was founded by David Kerr and his cousin Rich Grosskloss.
Okay.
So Dave was a parole officer here in the city of Newark, and he recognized that many of his parolees were returning to substance use, and as a result of the return to substance use, they were returning to prison. So he identified that the recidivism existed, where folks were coming out of prison and then they were returning to substance use and returning back to prison. So he decided to start Integrity House. He really didn't have any expert training in addiction treatment, but what he had was he identified the issue. The issue was recidivism as a result of drug use. And also he had a deep passion for helping people. So he left his job working for the New Jersey State Parole Board, and he decided to purchase a house here in the Lincoln Park neighborhood. This is back in 1968. The house he purchased was at 45 Lincoln Park, and he decided that he was going to ask the individuals who were on parole and who had motivation to stay clean and sober and not go back to prison. He invited them to live together with him in a house. His mom, Teresa Kerr, came up with the name Integrity House, which is very, very meaningful even to me today. And what happens is that when you have an organization that has the name Integrity House, it places the bar very, very high, and we need to make sure that everything we do, that we are acting and behaving with integrity. So we started with that single house back in 1968. Eventually, Dave started bringing in folks who had experience working with those who were addicted to various drugs. So he started to professionalize the staff, get certified counselors. His main source of finding these counselors was really finding people who were in recovery. So those who had the lived experience and then went on to undergo the training and the schooling to get a certification were really the core of the staff that Dave built at Integrity House. So that was back in 1968. Between 1968 and when I joined the organization in 1984, we expanded from one house to, I believe, 2 or 3 houses here in the city of Newark. I joined the organization in 1984, and at that point, Integrity really started to expand its footprint. So we were serving in the city of Newark. We were also providing services in Union County and Berkeley Heights. And I was employed here in Newark, and we would continue to just strengthen the continuum of care that we had here. And when I talk about the continuum of care, you have the residential program for those that are seeking recovery. And then you have that's a high intensity residential program. And then you have a low intensity residential program. That's where individuals still live with you, receive services, but they go out to work or they go out to school every day. So we started with the high intensity residential, and then we added other programs that were lower intensity, so that as an individual was making progress with their recovery, that the intensity of the services were reduced, and there was a bigger focus on them reintegrating into society.
Yeah.
So, and a little more, and this goes a little bit beyond Newark, is that when I in 1990 I got my first director job at Integrity House, and that position was to open up a facility in Hudson County in Secaucus, New Jersey. So I went up there in 1990, and I spent about 15 years up there building that facility, and then part of my journey as a staff member at Integrity House, kind of after establishing the Hudson County facility, was to come back here in Newark. And one of my goals, and this was probably around the year 2000, was to make sure that we had the full continuum of care at Integrity House. So what I mean by that is that depending on the person that you're working with, they have different needs. Somebody will come to you and they are severely addicted to opiates or alcohol, and they need a medical detox to get them started. And let's say in the case of somebody that comes and they do the medical detox, following the medical detox, they're going to need some long-term structured residential care. And then, as I mentioned earlier, they will phase down to less intense levels of care, such as we call it an ASAM 3.1 model of care, which is a low intensity residential care where they live with us, receive services, but go out to school and work every day. Yeah. And then following that is outpatient care. So really the ultimate goal when someone comes to Integrity House is that we want to wrap our arms around them, and we want to treat their addiction issues, mental health issues, and also the medical and dental issues that they've been neglecting for many years. So we wrap our arms around them, and we want to help them completely transform their life, reinvent themselves, and become a new person who is a productive member of society. And that happens as they go from the intensive residential to the less intensive residential, and then they get out, they live on their own, and they become, productive members of the community. Yeah. The other thing that's really unique for Integrity House is that there are many organizations that provide addiction treatment, and that's just a piece of what we do at Integrity House. Yes, the addiction treatment is really important, but in addition to the addiction treatment, the mental health, and and making sure that they're taking care of their primary health care, is taking a look at other issues that present challenges to them. So when someone is using drugs for many years, a lot of things break down in their life. And it could be that they dropped out of school, whether they dropped out in high school or dropped out of college. They may not have a marketable skill or a very good employment history. So that is something that we take a look at in Integrity House, that we want them to, if they dropped out of school and they still have a desire to further their education, we do GED classes here at Integrity House. We also have a relationship with Essex County College, where if the individual either never went to college or dropped out of college, we get them back on track while they're here at Integrity House, where they end up starting with online classes, and they eventually transition into a full-time student once they leave Integrity. Yeah. We also some folks may not want to go down the education path, so we go down the vocational path with them, and we do some job readiness work. We help them creating a resume, getting all the identification that's needed to become employed. We do interviewing skills, show them how to fill out an application online, and really get them, employment ready while they're here at Integrity House. Because the ultimate goal is that the intense services that they receive at Integrity House are just temporary. So it's temporary, intense services that gradually reduce in intensity, and then they're ready to just get out on their own and be a successful member of their community. And we have seen so many success cases over the years. Many times in the news, all you just hear the bad news. You hear about the overdose deaths, you hear about crime, the intersection of crime and drugs. But here at Integrity House, we just see so many success stories where we see folks who come to us that are pretty beaten up and broken down. And we, as I used the term earlier, we wrap our arms around them. We provide all of the services that they need, and then they return to very productive members of society.
Yeah.
I end up seeing individuals who have gone through the Integrity House program, and I see them maybe a year later or 5 years later after they went through our program, and I see them as, I may meet them as like a restaurant manager at a particular restaurant I go to, or I find out that they started their own construction business. But many of them end up gainfully employed. The other thing that breaks down during addiction are the relationships with their family and their support system. So that's something that we help with here at Integrity. And then as they move on and progress through the program, they are rebuilding the relationships with their family of origin, and also making sure that they're bringing other folks into their circle that are going to support their long-term recovery.
Yeah. You know, it's interesting when I think of the word integrity in this context, I think of a tree and how a tree's integrity is essentially its ability to stand up. And whether it's at the roots or at the branches, the things that impede upon its ability to stand up straight are the threats to its integrity. And, you know, listening to the points that you make about the folks that receive service and help and support here, it's like, you know, they are coming home carrying things that in one way or another they need to let go in order to stand up straight. You know, they're carrying things mentally, they're carrying things emotionally, they're carrying or not carrying things financially. And these things have an impact on their ability to stand themselves up, their ability to think straight, their ability to follow a discipline day after day, or the ability to build the lifestyle that they need to rebuild. But essentially, you know, the success is their ability to stand up, their ability to be somebody that you would bump into as a restaurant manager years later. And that's evidence of a lifestyle that has been set up and stood up. So yeah, that's fantastic. Are there any like memories that you have similar, like the restaurant manager? And I don't need to know anybody's personal information, name or anything, but what can you tell me a story or an example of something that you personally specifically experienced where you bump into somebody and, oh, that's so and so?
Yeah, I'd love to share that story with you. And I love you were talking about integrity, and you were talking about the integrity of a tree and its foundation and its roots, and really much of the work that is done when somebody first comes to Integrity House is to really work on building a solid foundation. And the solid foundation is really based upon just what they call adult daily living skills. I was talking to a client yesterday. He was here in the office, and he was talking about how being in the program is helping him because he has to be responsible. He has to wake up on time by himself. He has to make his bed every morning. And he even spoke about, the people talk about making your bed every day. It's like, even if you have a bad day, at the end of the day when you come home to a made bed, it kind of lifts you up a little bit, you know? So really the foundation is built here at Integrity House. The foundation of really being responsible, to learning to be patient and to work hard for what you want, and really, we try to also we want people to help each other at Integrity House. So you're here at Integrity House receiving services, but it's not just that you're not just a recipient of services here at Integrity House. You're more of a participant in services, where you receive the services, but you're part of a community where everyone is working together to help themselves and help each other. So a quick story. I was talking to you about the success stories, and there are so many of them. But I could tell you that I was at my grandson's lacrosse game.
Okay.
So I'm at my grandson's lacrosse game, and I see somebody on the sidelines that is wearing an Integrity House sweatshirt. And I see, I'm pretty proud when I see the Integrity House logo out there.
Right.
And I walked up to the gentleman and I says, nice sweatshirt. Where'd you get the sweatshirt? And he says, I went through the Integrity House program 5 years ago. He says, he came to Integrity House, and he was recently, before he came to Integrity House, he was incarcerated. After incarceration, he was homeless, and he was severely addicted to opiates. And he came to Integrity House. He went through the long-term intensive residential program. He went through our low-intensity residential, where he was able to go out to work every day. And now here he is at this lacrosse game, and he has, after 5 years, he has started his own electrical business. So he has, a fleet of vehicles, and he's successfully running an electrical business. He is back with the mother of his children.
Beautiful. And
his son is playing on the lacrosse field along with my grandson, and he is just gushing with praise about how Integrity House helped save his life, and all the blessings that he has today are a result of what happened at Integrity House. So it's very interesting. We love to have, I have an Integrity House button on here. We have Integrity House T-shirts. And what's pretty neat is when, the staff have this gear, but also clients have this gear too.
Yeah.
So when you see somebody in the community that's wearing something that says Integrity House on it, I'm going to be walking up to them and say hello to them. And in so many cases, I'm just hearing, a great story of restoration and transformation and redemption, which has occurred in their lives. So this is a person who was homeless 5 years ago and severely addicted to drugs, and now he has a successful business. He has restored the relationship with his family, and he is proudly raising his son, who is just thriving and doing well. And just to see that, so I'm telling you that to share a success story with you, but also to tell you why this work is so rewarding. That you frequently hear about the pitfalls and the overdoses and the negative things that happen, but we need to talk more about the success, about how many people, if they're given an opportunity. At Integrity House, when people ask me what the mission of the organization is, I say we exist to provide opportunities for individuals to transform their lives. That's why we exist. And the key is that I'm not saying that we transform people's lives. I'm saying that we provide an opportunity for the individual to transform their lives. And that's why I come to work every day. That's why most of the staff who work here come to work every day, that we just want to provide an opportunity for those that have a desire to change, to transform their lives at Integrity House. And it's and there are just so many people that they end up transforming their lives at Integrity House, and then they just anonymously continue to live and thrive in their community. And you would never know, them. You would never know that they at once were homeless or once were addicted to drugs. But we see the lives transformed and rebuilt. And just huge success stories, and even I don't want to break any anonymity of anyone that went through our program that's thriving right now, but I could tell you at our gala last year, we had a woman who spoke at our gala that went through the Integrity House program. And she was so proud to share her Integrity House experience with the attendees at the gala. And currently she is working, working in housing services in a large city here in New Jersey. And she was talking about how proud she is that she has that full-time job. She was recently promoted. She recently received her master's degree from Rutgers University. And she, recently, I guess, upgraded to a better apartment that she's living in. And then what she was really proud in is that she had a set of keys, and she's like, and I have a brand new Jeep that I'm driving right now. And this is someone who basically started, again, in this case, this woman ended up in prison. And from prison, she came right to Integrity House, and she really applied herself and put the work in and took that opportunity that we provide. And she went from someone that could have been just, cast away or forgotten about. But because we gave the opportunity, again, it's up to the individual. All we do is provide the opportunity. It was just such a proud moment to hear her story of transformation, and she added some humor into that story because she was just so proud that she was proud she had a driver's license.
Right.
But in addition to getting a driver's license, that she had a car, she had an apartment, she had a master's degree she completed, and she's actually making a big difference in the lives of other people right now because she's working for housing services and she's helping people with emergency housing and just providing, getting people off the streets and helping people improve their situation. So that's a great example of somebody that, came to us broken and took the opportunity to rebuild her life. And now, not only is she thriving, but she's also helping others to transform their lives in a different way. You know what I mean? She's not, doing the work that we do at Integrity House. It's more housing work, but when you talk about stories, that is just a high impact story.
How many people have come through Integrity House's doors since its founding?
So since our inception in 1968, tens of thousands of individuals have come through the Integrity House program and been touched by the Integrity House program. If you take a look, it's been 58 years. And, in the early days, it was just a handful of people who the founder was working with in the early days. There were maybe, he started with one house with maybe 8 people that he was working with. Within a year, within 2 years, by the time he got to 1970, he was working with, 50 to 100 people a year. Currently, we serve over 3,000 people a year through Integrity House. So when you ask how many people have been helped by Integrity House or touched by Integrity House, it's tens of thousands. I would guess if we really went back over the years, there's probably close to 100,000 people who have been helped and have had some experience here at Integrity House.
I want to talk a little bit about the folks who are doing the work here at Integrity House, you and the team that works with you. Firstly, let's talk from a administration point of view in terms of what it means for an Integrity House or an organization like it over the course of history in these decades that have passed, where there has been fluctuation of the type of support that an Integrity House gets, whether it's from federal government or institutions and foundations and whatnot. What have been some of the challenges that the organization has faced over the years in order to remain in service?
So we've faced many challenges over the years. And I know that when Dave Kerr initially started Integrity House, this is back in 1968, and he was living together with 6 to 8 individuals in his house that he named Integrity House. And he had the deep passion and the vision to help these folks. and he was just pouring his heart out to these folks. And he returned to the house one day, and everything was stolen. His typewriter was stolen by the individuals that he was trying to help. And at that point, there were some other little hiccups along the way. At that point, he was just about ready to give up. When he started Integrity House, it was self-funded. He did not have any foundations, any government resources, anything. And what happens when Dave tells the story is that, 2 days after he had everything stolen from the house, his typewriter, which was very important to him, a check came in the mail for $1,000 from a foundation that they believed in his work, and that kept him from closing up Integrity House, and provided him with some resources to keep going. And that was, that challenge he experienced was well before I arrived at Integrity House. But that was one of the early challenges, was really just getting it off the ground. And I just have so much admiration and respect for the man. He was the founder of Integrity House, and he started with nothing, and he just gave of himself to help other human beings, not expecting a paycheck or anything. Other challenges that we've gone through over the years would probably be when I joined Integrity House in the 80s, was in the middle of the AIDS epidemic. And it was a very, very challenging time for us here at Integrity House, where we had staff members who were people with lived experience that were working here, that were diagnosed with AIDS, and they were dying. We had clients who were living here who were diagnosed with AIDS, and there was no cure at that time, and they were dying. I could tell you that I became a counselor intern here in October 15th, 1984. Counselor intern, very green, really. All I had was, again, I had the passion and desire to help people. And I was given a caseload, and I had 2 individuals in particular. I have a caseload of 12 clients. 2 of the individuals had AIDS at the time, and both of them ended up passing away. They ended up going from Integrity House. At different times, they got transferred to St. Michael's Medical Center, which was that's where you went if you needed treatment for AIDS at that time. And both of those individuals passed away. The other ironic thing is that I really started in the summer of '84 volunteering here at Integrity House. And then in the fall of '84, one of the counselors had AIDS and had to go back on medical leave. And that actually, I ended up taking over his caseload. And that's how I got introduced to the work that I was doing. So during that time, we had staff with lived experience that were committing their lives to helping people that were getting diagnosed with AIDS. And they were, at that time, you got a diagnosis of AIDS, if you lasted a year, you were doing well. But many clients and several staff were passing away, and it was a very, very turbulent, scary time at Integrity House for everyone. All of the clients at Integrity House were getting tested for HIV/AIDS, and just it would take a week or 2 to get the test results back, and the anxiety experienced by the individuals here was just off the charts. And what you had results coming in, and some people were getting a negative result and they were happy, they dodged a bullet, and others were getting the positive result where at that time it was a death sentence. So as far as the culture of Integrity House, that was probably the toughest situation that we dealt with back in the 1980s. And that, it was really, I started working here in '84. I would say between '84 and 1990 is when we really, our community here got hit really hard with the AIDS epidemic. Other challenges that we had, I really need to just fast forward up to the year, 2020 and COVID hit Integrity House. So what happens is that, we have a large, the people that we service in residential and outpatient. In our residential programs, which is a congregate care setting, similar to what you heard on the news about nursing homes, et cetera. So in those congregate care settings, at some points we had up to 50% of our population that were testing positive for COVID. And when it first hit, again, people thought they were going to die.
Yeah.
They had a fear of dying, of COVID. So, our staff at Integrity House, I have a T-shirt that actually all it says on it is resilience. And then underneath that in small words, it says strength starts with integrity, Integrity House. And I could tell you the resilience of the Integrity House staff going back to 2020 and 2021 was just incredible because a lot, staff were scared, the clients were scared, the family members of the clients that were here at Integrity were scared. Some of them were driving up to our front door, walking in the house saying, come on, you need to come with me. We want to take you home. In some cases, so that we all die together at home. That is the, it's hard to believe, it was 6 years ago at this time that many people thought that, if you contracted COVID, that there was a high likelihood that you were going to die. And we really, it was a staff at Integrity House where, we had counselors and counselor interns that were, and we have a nursing department and doctors all, but we had the counselor interns and the counselors that were just keeping an eye on people. We had people in isolation, we had quarantine rooms, we were doing pulse ox checks every 2 hours, temperature checks every 2 hours, keeping everyone hydrated, and it was almost a it was crisis management at that time. And I'm just so proud of the Integrity House staff. Like the work was just incredible. The work was just incredible. That they were just so selfless and just really cared so deeply about the individuals in our care that they really were putting the individuals first, and we made it through that crisis. So now we're in 2026. 2026, funding is not stable. What's happening is that it's kind of getting, the way I describe it, is kind of nipping at the edges, where there is, it starts with the federal government, that the federal government, the funding that comes from the federal government to the states that then comes to places like Integrity House is in jeopardy. And it's not as robust as it once was. And it provides many challenges for Integrity House, where we need to do private fundraising to make sure that we have the resources to treat all the people that need help. The other thing that's happening with Integrity House is that many of our clients who come to us are on Medicaid. They're on Medicaid only for a short period of time because we work with them to help them transform their lives and get back to work. But what's happening is that it's becoming tougher and tougher to keep your Medicaid coverage, and it's going to get a lot tougher in 2027. They're going to implement work requirements, where if an individual is on Medicaid, they're going to have to put in 80 hours a month of work requirements. And that could be it could be work, it could be school, it could be volunteer work. So we are going to be working with folks to help them fulfill those work requirements and keep their Medicaid. The other challenge is going to be recertification. Individuals are going to have to recertify their Medicaid every 6 months. And I know, I have health insurance, through Integrity House, and I can't even imagine needing to re-enroll every 6 months. Health insurance is very complicated, so we have individuals that work here at Integrity House, entitlement specialists, that are going to help the Integrity House clients.
Yeah.
But the federal government is looking to save $1 trillion over the course of 10 years. They're not coming out saying that they're cutting Medicaid, but what's happening is that they're really putting the squeeze on people where it's going to be difficult for many people to hold on to their Medicaid because of the work requirements and because of the recertification provisions. So that is a challenge that is on the horizon.
Yeah.
And again, you know, it's unfortunate, but we're going to have to rely on private fundraising, and we have some very generous donors that are consistently supporting Integrity House. And in many cases, we use those funds for innovation and developing new initiatives here at Integrity. But we're going to need those funds just to make sure that we could cover the expenses of providing services to people who come to us that have no Medicaid or no type of insurance or reimbursement attached to them.
You know, I mean, over the course of history, and I'm sure I won't capture everything, but the organization goes through, we'll say, a number of wars that have been fought since 1968 that have had impact in Newark specifically. You've got the crack epidemic, you've got the AIDS epidemic, you've got the COVID pandemic, you've got opioid pandemic, you've got 9/11, you've got even things that have happened just locally here in Newark specifically. And the staff here, the folks that are working here, are already working they're doing a work that has an urgency to it. You know, people are fighting to live, ultimately.
Yeah.
And on top of that is all these world events and local events and pandemics and endemics and epidemics and all these things. As a team of people, as an organization, how do you, what does it take to maintain humanity and kindness and empathy in a work that is so urgent and volatile and under so many different pressures, while the folks that are being serviced and the folks that are doing the servicing essentially, at least on paper and since the AIDS epidemic, have so much that they don't have in common. And by the time they have something in common, they're not in a working relationship anymore. Now this person is the restaurant manager or at the lacrosse game or what have you, and not working together. But I guess what I'm asking is how do you maintain an environment and a culture where the staff who are doing this work are equipped to maintain their own mental health, dignity, empathy, kindness, so that they can do this work earnestly and not get swallowed up by the work?
Yeah, well, that is that's a huge challenge that is facing Integrity House and most organizations that do the type of work that we do. Because what's happening is that, and you've mentioned like events that have occurred, you know, the AIDS epidemic, and right after AIDS was the crack epidemic. And then we had heroin on the rise, and then we had 9/11, and then we had COVID. So you have all this happening, yet the staff who work at Integrity House, so they are impacted. You know, they basically, experience trauma as a result of world events and local events that are happening. And then they're asked to come here to help folks who are broken and need a lot of help. Something that you mentioned, you were talking about kindness and empathy. And when I think about, we have so much kindness, compassion, and empathy among our staff here at Integrity House that it's just, I'm in awe of our staff here at Integrity House. That frequently, when we're looking at folks to join our team and work here, we have about 260 staff that work here at Integrity House. They'll have a profile with their degree, their certification, etc. What's really, really important to me is empathy and kindness. That you can't learn that in school or through a certification program.
Right.
But if you want to do the type of work that we do here at Integrity House, and you want to be part of this community and part of this team, that empathy and kindness are really prerequisites. And you could get, it's something that's highly valued here at Integrity, highly valued by me and highly valued by my senior leadership team here at Integrity House.
Yeah.
Even, but it's complicated. And it's complicated because frequently we're working with individuals who, when they first come to us, they have a lot of ambivalence. And that ambivalence means that one day that they're motivated, the next day they're not motivated. So the staff needs to remain consistent in their approach. The work, everyone is stretched thin in the work that they have to do. The regulations continue to increase. The reimbursement or the funding does not increase. So we're being asked to do more with less every day. And I think what really, the empathy and kindness is basically, that's kind of the North Star for ensuring that we remain focused on our mission, and also remind the staff that you need to take care of yourself, that there needs to be self-care that takes place.
Yeah.
You have to get the job done here at Integrity House because we're here to serve the clients. And then what we ask of you is that you make sure that you're practicing self-care so that you're healthy enough to help the person who needs help. They on the airline, they tell you, put your oxygen mask on first before you help another person. And it's the same thing working, doing addiction treatment and mental health treatment, is that you need to make sure that you're taking care of yourself to be most effective in helping others.
Last question I got for you is in regard to the future. So for Integrity House, knowing the current changes in the landscape and environment, as well as what's coming down the pipeline in regard to changes, what are you looking forward to? Like, what is, in the next 3 years, 5 years, and that outlook? What is it that you are looking forward to stepping into or achieving or experiencing as an organization?
Yeah. Well, what we're looking forward to is that there are a lot of challenges right now, and but at the same time, there's a lot of research that's occurring, and Integrity House is involved in some of the research. And some of that research is exploring new, innovative interventions to help people enter recovery and maintain their recovery. So I have a lot of hope for the future. Sometimes it's the interventions include medication. Sometimes it involves talk therapy, and sometimes it involves a combination of the two. So I believe that we are on the right track when it comes to science and making sure that we're advancing our field. So that's what I look forward to. And at the same time, we have to make sure as Integrity House, from a leadership administrative perspective, that we remain battle ready for the choppy waters that lie ahead, that we remain nimble, flexible, and that we could adapt to any changes that come our way. Sometimes there are changes made at the federal level and at the state level where there's unintended consequences that end up hurting the people that we are trying to help. And we need to remain positioned and poised to to navigate those choppy waters and make sure that Integrity House remains successful and make sure that the population that we've been serving since 1968, that they continue to have that opportunity to transform their lives.
Thank you, Bob.
All right.
Appreciate you, man.